Hey y'all. I hope everybody's having a great day today. Just thought I would jump on here. I hadn't done a recording every week like I thought I was going to. I've had some things going on, but I wanted to jump on here today for a couple reasons. Um, First off, I just, as you can see, my skin has finally cleared up. Now, I'm on Cellcept, is what my doctor put me on. I don't know as far as if it will help with pleva, for someone that just strictly has pleva, but I do know that, like with lupus, it has helped me. Now, so I've got that, and then I also wanted to show y'all just my skincare routine that I do. Of course, the face is washed, but I have a couple of things. This is Tula. It's a kind of a brightening stick, as you can see, but it's also good for like the dark circles because I'm telling you, your girl always has raccoon eyes. I was born with raccoon eyes. But I just take this, and you want to be careful not to get it in your eye, but just around it real good. And that way, you're looking at those little fine lines and wrinkles, that we start getting when we're my age. You want to, you know, just keep your skin moisturized. And also, with having the lupus, I mean, and even if you don't have lupus, even if it's just, you're wanting to follow a good skincare routine, I actually take this too up to my forehead where I do have my laugh lines and down here, just to kind of give it that little extra, how you'll get a little line there. So all that's on. But anyway, it's really important for us to keep our skin moisturized. Like I said, I have a process I use. I've got this Tula, and then also I love, love, love. This is my favorite lotion. It's Pure Lace, and this one's the matcha green tea. The Blue Lotus is really good too, but it's just a very smooth cream, and I put that on my face before I do makeup. And with that, it just absorbs in. And I figured I'd just show y'all exactly what I do as far as some moisturizing. And while it's soaking in, we can talk a little bit about some stuff that's been on my mind. Okay, so while I'm absorbing my lotion, I did want to talk to y'all a little bit because I've had several people ask me what my thoughts were on the COVID vaccine. Excuse me, I need a drink of my coffee. And yes, I have my cats on my coffee cup. I know I'm that bad. Okay, here's my thoughts on the COVID vaccine. I think it's an individual choice. And I know I'm going to catch heat probably from some of my friends because I know the narrative right now is pushing really hard for everybody to be immunized. I know a lot of people are scared to take the vaccine because it, it was developed so quickly and not gone through the lengthy trials that other drugs go through. That being said, I did debate myself about whether or not I was going to take it. And what decided it for me was, those of you know me know that I have kidney disease, chronic kidney disease. So when I went to my nephrologist's office, because I'm supposed to clear any new medications with them because of how they affect my kidneys, I asked their opinion, what they thought, as far as if I should or should not take the COVID vaccine. My kidney doctor's office told me, do not take it. And the reason they said that was because, sorry, my nose is itching. Reason they said that was because of the kidney damage that I have. What they told me was they were seeing a spike there in the number of people that are actually on dialysis now. Now, she didn't say it was because they took the COVID vaccine, but they had either had COVID or had the vaccine. So, I mean, draw your own conclusions. But they advised me not to take the COVID vaccine. So, I'm not going to take it at the advice of my doctor. Now, I have several relatives and friends, that are in the medical field. And what I'm finding is a lot of them are, kind of divided on whether or not they're going to take the vaccine. Um, and I have to agree with this one principle because, y'all, I'm not an anti vaxxer. I think that it's important to have vaccines. My kids had their vaccines when they were little. I know that, you know, it's very important, but, I know that those drugs were tested quite a bit longer than this has been. My, I'm just going to say, my niece, who I love dearly, and she's very well established as an RN, has been in the field for quite a while, and I know that she's not taking it, and I firmly believe that this should be a choice, for everybody whether or not you take it. I mean, and if people want to, draw lines, where, okay, you can't get on that flight if you haven't had the vaccine, that's fine with me. I really, like my doctor told me, not to take the vaccine. If I'm out and about in public around a lot of people, I can mask up. And that's my decision. No one has a right to take my decision away from me. Just as on another topic, people are talking about Roe v. Wade right now. If you stand up for a person's personal right over their health, you cannot pick and choose which thing you want to support. And like I said, I know I have a lot of friends that are probably going to be like, giving me a little heat about saying that, but it's the truth. You either believe in a person's autonomy to control their physical health or you don't. And I do, and it is my choice. Based on my doctor's advice, I will not be taking it. Now, that being said, I don't want anyone not to take it because I'm not. I want you to ask your doctor. I want you to, find out what your, you know, I guess you could say make an informed decision what is the best for you. But those are my thoughts on the vaccine. And I hope that maybe it helps some people, understand a little bit. But the main thing is just check with your doctor, find out, based on your medical issues that you have, if it's a good idea for you or not right now. And y'all all have a blessed day. Love you to death. Talk to you soon. Bye bye.